Oh, good luck. Welcome to the opening event for 2025's National Nursing Week. This year's theme is the power of nurses to transform health. My name is Stephanie Tolngok. I'm an Inuk nurse, originally from Iqaluit, Nunavut, and a beneficiary of the Nunavut land claim. And I'm currently living and nursing in Yellowknife, Northwest Territories. I'm also a member of the CNA board. I am named for Tolngok, who was a powerful healer, and this name and my family and community, as well as my experience as a nurse, have led me to almost 15 years of advocating for Inuit within healthcare. On this journey, I found my way to the CNA board. So thank you all for joining the CNA Fireside Chat, the role of nurses in Indigenous healthcare, looking at the past, present, and future. I acknowledge that we are all tuning in for this virtual event from coast to coast to coast on the ancestral and unceded territories of First Nations, Inuit, and Métis peoples, who are the past, present, and future caretakers of this land that we call Canada. Now, in the Inuit way, I ask that we all take a moment to center ourselves, to have our collective spirits and hearts open and ready to learn, reflect, and grow together. I want to remind all participants about CNA's commitment, working together towards reconciliation and healing. And this is one of many events that CNA will be hosting in their commitment to listening, learning, and taking meaningful actions towards reconciliation. It's now my privilege to introduce our speakers today. Hilary Fry. Hilary is the Indigenous Policy Analyst at CNA. She is of mixed ancestry with one Labrador Inuk and one settler parent, and is a beneficiary of the Labrador Inuit land claim. Hilary was born and raised in Happy Valley, Goose Bay, Labrador. Through working as a registered nurse for 10 years in her community, she quickly realized that there were many disadvantages faced by Indigenous peoples accessing healthcare. These experiences contributed greatly to her passion for the achievement of health equity for Indigenous patients through culturally safe care. She believes that systemic change is needed, which can be influenced through advocacy efforts like policy, which is the core of her work at CNA. Marilee Nojizik. Marilee is a First Nations and Eagle Clan member of the Fort William First Nations near Thunder Bay, Ontario, and is a member of the Robinson Superior Treaty Region. Marilee currently lives in the unceded territory of the Algonquin Anishinaabe people in the National Capital Region, otherwise known to many as Ottawa. Marilee is currently the CEO of the Canadian Indigenous Nurses Association, or CINA. They are the voice of First Nations, Inuit, and Métis nurses from coast to coast to coast. Marilee has tremendous experience, enthusiasm, and passion about working in Indigenous health. And this stems from an over 25-year-long career in contributing to the concerns, issues, and unaddressed imbalances of Indigenous people in health, education, employment, and many more topics. Marilee recognizes that the current environment is rapidly changing, even as we prepare to lay the foundation for future generations. Brianne Smart. Brianne is from the Six Nations of the Grand River, a member of the Seneca Nation and Turtle Clan, and comes to you from the traditional lands in Southern Ontario. Brianne works alongside Jennifer at Envision as the Senior Reconciliation Consultant and is pleased to be supporting CNA in their journey towards reconciliation. Brianne brings perspectives from her role as chair of the board with Aboriginal Health Access Centre that works to serve the urban Indigenous population in 3 cities in Southern Ontario in the Niagara region. Their mandate is to offer a blend of traditional and Western medical care, and they have a mix of Indigenous and non-Indigenous nurses across the 3 sites. So to our speakers, I say Kriyan Namik and welcome. Our moderator for this panel today is Jennifer David. Over to you, Jennifer.
Miigwech, Wache, Ani, thank you. It's my pleasure to be here. As mentioned, we are here to participate in a fireside chat that's called The Role of Nurses in Indigenous Healthcare, hosted by the Canadian Nurses Association in partnership with CINA and with Envision for Nurses Week 2025. Jennifer David and Tisnakasen. My name is Jennifer David. I too am of mixed ancestry, which includes Anishinaabe and Cree, and I belong to the Chapleau Cree First Nation, which is in Treaty 9 territory. And I'm joining you from Ottawa, where I'm here on unceded and unsurrendered Anishinaabe Algonquin territory. I will be your moderator for this 60-minute fireside chat. I am a senior consultant and the lead of our Truth and Reconciliation Service Basket at Envision Insight Group. Envision is a majority Indigenous-owned consulting company with offices in Ottawa and Iqaluit, Nunavut. And we are working with the CNA on several truth and reconciliation projects. And we've organized this webinar as a panel. You've been introduced to our three panelists. So we are going to have four topics in our discussion, a lot to cover in an hour, but we hope this will just plant the seeds for further education and interest in this topic. So number one, we're going to talk about colonization and racism against Indigenous peoples in Canada's healthcare system. Number two, we're going to talk about the impacts of this colonization on Indigenous people's health. Number three, we'll provide you with some guidance as you are nurses for how to address these impacts. And number four, we'll talk about some ideas of how to move forward together on this journey of truth and reconciliation. And then we'll open it up for some Q&A. So a few housekeeping items before we begin. This panel is being recorded and it will be available on CNA's YouTube channel. And you can check back as we will upload it there. We will take questions and it will be through the Q&A function that you should be able to see on your screen. You can ask your question at any time. When we get to the Q&A session at the end, before we finish this hour, we will be able to, your questions will be put forward and then we'll answer them. If you do have a question for a specific panelist, please name that panelist so we know who to direct your question to, or if it's for everyone, just say everyone. The chat has been disabled, but again, you will see the Q&A option. As the panelists are speaking, feel free to, again, pose your question there. We do have someone from CNA monitoring those so that we can organize them at the end. We will end this webinar in less than an hour now at 1 p.m. Eastern Time. And before I begin, I just want to advise you that some of the topics that we will be discussing are distressing and may be triggering or may bring up emotional responses from you. If you need to step away or if you need to reach out for support, please do so as you see fit. Please take care. What I would say, however, is that it sometimes is important to be uncomfortable. If you find it uncomfortable to listen to and hear about what's happened to Indigenous people through colonization, please imagine what it is like to be an Indigenous person and on the receiving end of colonization. And so it's important that as nurses, you understand this history and this context. But I do say, please take care. So let's begin our first topic, colonization and racism. First Nations have lived in what we now call Canada since time immemorial. So you may have heard that term before, time immemorial. So I have a degree in journalism and English literature, and I've done communications all my life. And words are important. This word immemorial, the root word of immemorial is memory. So what that means is that First Nations have no memory of coming to this place that we now call Canada. We have no memory of being from or in another place. So everything that makes us who we are is rooted in this place. And Inuit have been here for thousands of years, and Métis have been here for hundreds of years. We've had our own traditional medicines, our own practices that encompassed health and well-being. But once Europeans arrived on our shores, we start to see a drastic change in Indigenous health and well-being. These Europeans asserted sovereignty, meaning that they were European and First Nations were considered savages. So of course, they would be in charge. They needed to Christianize, they needed to civilize these, quote, Indians, as they called them. They forcefully disregarded and ignored traditional ways of knowing and being, replacing it with European ways. And this came to have a devastating impact on First Nations, Inuit, and Métis peoples that we are still dealing with today. And I'm going to ask each of our panelists to give us an example of how this colonial attitude, this Western medical paradigm, has caused great harm to Indigenous peoples. So I'm going to start first by turning to Mary Lee. What would be a couple of examples that you have about how this Western medical paradigm has caused harm to Indigenous peoples?
Thanks a lot, Jennifer. So, welcome everyone to Nurses Week. First of all, I'd like to thank Stephanie for the opening that you have done in a good way, and to my colleagues on this panel. I'd like to welcome all of the nurses and those healthcare providers who have joined this Zoom call during your lunchtime. So let's do really fireside. Let's light this up. Colonization and the impacts on our people. We want to focus on systemic racism. I'm really glad that Jennifer pointed out, immemorial, the memory. I'm going to point out something else that'll kind of stick, and we can play with that a bit. Colonization, the colon. Let's go from there. Take it as you will. What we want to be able to focus on is the fact that Indigenous nurses could not apply to nursing schools prior to 1960. That left many of us. I'm not a nurse, but that left many Indigenous healthcare um, practice or providers without a license to become a nurse until after that time. So our numbers are just coming into play in the nursing paradigm. Having said that, and we are now in our 50th year as of 2025. It's an exciting time to be an Indigenous nurse, and I honor and I'm privileged to work with them. While I look at this, I look at the traditional practices that are now being able to become part of the practice that nurses can have without being arrested, without being fined. They use it as alternative approaches when they don't have all the bells and whistles. They utilize that as part of being able to consume the Western medications and some of the other medicines that are being provided to our people, regardless of where they live. They need to absorb them. When we're looking at the disappearance, we also are looking at some of the toxic environments. Mothers unable to wash their babies, formula because we got to boil water, you got to do this. It's it it is an exciting time, and we have to utilize the tools that are before us to become part of the change and be that agent that will respond to the calls to action. Thanks a lot.
Thank you, Mary Lou. Hillary, would you have an Inuit example or two?
Yeah, so unfortunately, Inuit have experienced many health-related colonial harms at the hands of the Government of Canada. TB sanatoriums in particular have had a devastating impact. In the 1940s to 1960s, thousands of Inuit were forced out of their northern communities to the south for TB treatment. And many Inuit spent years at TB sanatoriums, disconnected from culture and way of life and from family, often without family knowing whereabouts, even up until the day they died. Many families still do not know what happened to their loved ones during their time at TB sanatoriums, and numerous survivors describe their experience as traumatic, with limited and poor quality food and mistreatment from medical staff. My late grandmother, who we all call Nena, was one of many Inuit who had to travel away from her home for the treatment of TB. It was 1956. She had 3 children under the age of 3 and had no choice but to leave them behind to be cared for by family. She described it as the worst thing she's ever had to do and wondered if she would ever even make it home. She spent an entire year there, the only means of communication via mail. My Peppa wrote her nearly every day and would send her money for wool so she could knit to pass the time. And although she described her time away as long, the food as bad, she considered herself to be one of the lucky ones. Overall, she was young and healthy and remembered helping to care for other patients who were in worse condition than she was. She recalled that many were not as fortunate enough to make it home as she did, and when she came home, she was still taking 21 pills per day. I don't know many Inuit whose families have not been impacted by TB sanatoriums in one way or another. And this experience continues to shape how Inuit experience the healthcare system today, contributing to a deeply rooted mistrust of the system, often resulting in delays in seeking care. And further, TB in Inuit Nangat remains a significant public health crisis, with rates of TB for Inuit 26 times higher than of the average Canadian.
Thank you, Hillary. Again, if you hadn't heard these stories, we realize how heartbreaking they are. Thank you for sharing that. Brianne, do you have an example of what colonization would have looked like for Indigenous people from your perspective?
Absolutely. I just want to say, Nyalgo, thank you to you, Hillary, for sharing a personal story. I mean, it's not unlike others have experienced, but sharing that from your own history and your own story. I just appreciated your words. Thank you very much. I think we'll just follow with your sort of introduction, Jennifer, and what other folks have shared. It's that it's important to remember that there were fully functioning societies before colonization. Everything was happening. Everything had been happening since time immemorial. We've taken care of each other. We've had our governance systems. We've had a way of life that was imposed upon. And so, this also included, of course, healthcare, medicines, wellness practices, and that knowledge was not respected with colonialism. It was not even not respected, it was dismissed, disregarded. And so, from my perspective as a Haudenosaunee person, things like our matriarchal systems were so important, and those traditional councils, they were done away with. They were moved away, moved aside. And that includes things like our plants and our growing systems. So the medicines we would have used, those traditional practices, they were sort of dismissed in favor of that European way, the way it needed to happen, that Western approach to medicine, which was just inherently at odds with the traditional ways that we would have lived. When we were in our own spaces, longhouses, we couldn't live in community the same way. So there's a number of things that were just impacted that then, of course, impacted overall health and wellness.
Thank you so much for that, Brianne. So these are just a few examples, and unfortunately, in this hour, we don't have time to talk about all of the devastating impacts, but the reality, things like medical experiments done on children in residential schools, the extinction of animals and our plants, our way of life has all impacted Indigenous health. There are ways that you can learn more about this, and Hillary will be talking about an opportunity to learn more that's coming up in September. But I would like to move on to our second topic so that we can have a bit more of a discussion about what it means to understand what's happened in the past, because we have to understand that these colonial attitudes led to laws and policies that continue to cause great harm to Indigenous peoples. And there are two significant consequences that we see today. One of them, and it was mentioned earlier, racism against Indigenous peoples in Canada's healthcare systems and poorer health outcomes for Indigenous peoples today. So I'm just going to share my screen, and I'm going to play a short video about how we're still dealing with these consequences. So let me share my screen. Usually I can do technology as long as it's simple enough. All right, so you should still now see the cover page. And so I'm going to go to a slide that just has a short video. So hopefully you'll be able to see and hear this video.
What have been the health impacts of this racist and inhumane treatment of Indigenous peoples? Here are some examples. Residential school survivors still suffer from the impacts of those nutritional experiments, as seen in patterns of diseases like diabetes. There's a very real hesitancy among many Indigenous peoples to seek medical help or get vaccinated or visit a hospital because of racism and past trauma. Medical professionals are often unaware of the realities of Indigenous life. They may discharge patients into dangerous or unsafe situations or send them back to communities where there is no follow-up care or adequate support. Inadequate health, dental, and mental health supports for children and inequitable funding for children on reserve has led to poor health outcomes, mental health crises, and suicide epidemics. Reliance on unhealthy but inexpensive staples such as flour, sugar, and salt has led to a disproportionate number of people with chronic diseases such as diabetes. food insecurity, particularly across Inuit Nunangat, because the cost of junk food is less than the cost of healthy food. And we see startling health statistics, such as the high TB rate. The suicide rate is 3 times higher than the non-Indigenous rate. While the general population has a 5% chance of getting diabetes, that jumps to 17% for First Nations individuals living on reserve. Infant mortality rates are up to 4 times greater than those of non-Indigenous newborns, and on and on.
So what do we do about this? Senator Murray Sinclair, who recently passed away when he was chair of the Truth and Reconciliation Commission, said a lot of wise things. And one of the things he said was that it took 7 generations of Indian residential schools to get us to where we are today. And it's going to take another 7 generations for us to say that we can move beyond it or get out of it. But we need to be doing this work now, because he also said that reconciliation is uncomfortable. And so now, as we come into the second half of this webinar, we need to think about the work that we need to do. And we need to ask the question about what you can do as nurses and what can you commit to doing, to being uncomfortable. And Murray Sinclair said that the commission, the TRC, gave us reports, they gave us calls to action. And when they issued their reports, Murray Sinclair said, quote, "We have described for you a mountain. We have shown you the path to the top. We call on you to do the climbing. What will you do as part of your climbing?" So again, I'm going to share my screen because there are some good sources of guidance to do this work. And we're going to spend a little bit of time talking about 2 of them. The first one is the Truth and Reconciliation Commission's calls to action. And I highly recommend that you check them out. They're in plain language. There are 94 calls to action, and there are specific ones that are for nurses. And I think somebody's going to put the link to the TRC's calls to action in the chat. But if no one does it in the next few minutes while people are speaking, I'll put it in the chat. And I just encourage every one of you on this call to check out those TRC calls to action, because it's not just for other people and it's not just for government, quote unquote. Every Canadian should be able to see themselves in the TRC's calls to action somewhere. So as I share my screen, I'm going to share the particular calls to action that are related to the TRC's calls to action for nurses. So where are we? Oh, maybe I'm already still sharing. Am I still sharing my screen? No, you don't see it. Okay, all right, then hold on a second. This is where the technology hopefully will not fail me now. There it is. Okay, slideshow again. All right. So we should now see there. All right, calls to action from the TRC. Call to action number 22. We call upon those who can effect change within the Canadian healthcare system to recognize the value of Aboriginal healing practices and use them in the treatment of Aboriginal patients in collaboration with Aboriginal healers and elders where requested by Aboriginal patients. And call to action number 23, we call upon all levels of government to 1, increase the number of Aboriginal professionals working in the healthcare field, 2, ensure the retention of Aboriginal healthcare providers in Aboriginal communities, and 3, provide cultural competency training for all healthcare professionals. And then call to action 24. We call upon medical and nursing schools in Canada to require all students to take a course dealing with Aboriginal health issues, including the history and legacy of residential schools, the United Nations Declaration on the Rights of Indigenous Peoples, treaties and Aboriginal rights, and Indigenous teachings and practices. This will require skills-based training in intercultural competency, conflict resolution, human rights, and anti-racism. So let's stick on that slide for a minute. And so what I want to do now is I'm going to ask each of our panelists how these calls to action are being addressed within their organizations, within their spheres of influence in the work that they're doing. So first of all, I'm going to turn to Hilary and ask, what is the Canadian Nurses Association doing?
Thank you, Jennifer. I think it's important to start by saying that CNA recognizes the enduring impact of colonial practices and policies on the well-being of generations of First Nations, Inuit, and Métis peoples in this country, and further, that the nursing profession has perpetuated the role that the nursing profession has played in perpetuating that harm. Nurses, for example, would have been of the primary caregivers in TB sanatoriums that I had previously shared, which was just in the mid 1900s, not that long ago. The CNA actually existed during this period in time. As CNA's first Indigenous policy analyst, I am proud of the steps that CNA is taking to uphold the Truth and Reconciliation calls to action. Before my time at CNA, an Indigenous Relations Actions Council, IRAC for short, was established. IRAC consists of a group of approximately 12 volunteer Indigenous nurses from different communities across the country. IRAC, with their valuable wisdom and insight, have contributed greatly to the Indigenous health and anti-Indigenous racism work that CNA has undertaken. CNA also recognized the importance of having an Indigenous voice in CNA staff and created an Indigenous specific policy analyst position, which is now me. There are 4 streams of work just for this year that CNA has committed to on their truth and reconciliation journey. The first being this fireside chat, which demonstrates respectful allyship with our partners like CINA, so happy to have you here today, Mary Lee, and our endeavors to enhance the quality of life and improve health outcomes for First Nations, Inuit, and Métis patients, families, and communities through nursing and healthcare. The second stream of work includes fostering a holistic and organization-wide approach to developing and implementing a reconciliation plan. This framework will be completed through an in-depth consultation process in partnership with Envision and guided by the wisdom of First Nations, Inuit, and Métis leaders in nursing. Thirdly, in addition to our CNA staff having already taken this course, CNA will be making an Indigenous cultural awareness training available to its members in the fall of 2025. This will include a specific module related to anti-Indigenous racism in nursing and healthcare. And I ask all of our members to stand by for later information. And finally, CNA is advocating for culturally responsive and safe healthcare, including solutions for addressing anti-Indigenous racism that have been co-developed with First Nations, Inuit, and Métis leaders. CNA's inaugural Anti-Indigenous Racism Knowledge Sharing event scheduled for this fall represents an initial step toward this vision. Although CNA are taking many positive steps forward, it is important that as a non-Indigenous organization, we must acknowledge we cannot undo the harms that have been caused and that we are in our infancy stages of truth and reconciliation. There is much work that needs to be done, work that must be led by Indigenous nurses and community leaders.
Thank you so much for that, Hillary. Now I'd like to hear from you, Mary Lee. Perhaps many or all of the nurses on this call don't know yet anything about the Canadian Indigenous Nurses Association. So please share with the nurses on this call what CINA is doing and how you can support nurses as they address these calls to action from the TRC.
Thanks so much for that, Jennifer, and thank you, Hillary, for the great positioning you put forward from the Canadian Nurses Association's lens. As everyone has heard, Canadian Indigenous Nurses Association is an advocacy and organization to bring the voices forward of First Nations, Inuit, and Métis nurses and healthcare providers across the country. However, as we are the longest standing healthcare organization in the country, celebrating 50 years. While we have half the time of existence to that of CNA, we bring forward a world of expertise and knowledge that is Indigenous nursing, Indigenous people, and it is protected by many centuries of our ancestors. I would invite you to look at our website for the Canadian Indigenous Nurses Association. I would invite you to become a member and support the actions and the activities that we are doing to addressing the Truth and Reconciliation Commission's calls to action. While you have pointed out 3 of them, which are significant, we are also very encouraged to be working with our partners and establishing the relationships that we have. Like with the Canadian Nurses Association, we have many, like with the Canadian Association of Schools of Nursing, to looking at Indigenous content into those programs. How is that going to be done? Whom is going to attest to it? How will it be verified? No more of our Indigenous nursing students teaching the classes.
Mm.
What we are looking forward to here is a responsibility that the TRC is not an Indigenous activity. It is not my role. It is not my responsibility to make sure that you respond to the calls to action. However, it is my role and it is my responsibility to ensure that you understand Indigenous engagement authentically, not just tick the box, not just a rubber stamp, and not just using one voice to be the paintbrush for your Indigenous commitments. Once you step into that realm, you're in it for the rest. Exiting will be extremely hard, as hard it was to be able to realize the truth of Indigenous health, healing, and wellness in the current 21st century. The other ones that become important here are the TRCs is number 7, number 10, and number 57. Take a look at them. You'll understand why later. It's about education, employment, and training and skills development. Those need to come to the forefront. While there's a section on health, which Jennifer and Hillary have pointed out here, there are other areas that will impact how you're going to do this. With the TRC and CINA, we have opened up our doors. If I'm expecting you to participate in a meaningful and authentic way, I have to open up the doors and accept the participation and application from non-Indigenous healthcare providers wanting to support the activities and the plans of CINA. Therefore, the only thing that you won't be able to do is vote. But you will be able to be engaged in policy development, regulatory affairs, legislative impacts, and many other things. Some of the other areas that I need to be able to allow you to focus on, is this your role? Your ancestors are behind you, not just our Indigenous ancestors. You also, as non-Indigenous people, have ancestors standing behind you who brought you to this country, who brought you to a better way of living. Now we're going to put forward all of those generations and those mind thoughts and put them together in how we're going to be able to face truth and reconciliation. The other thing that I want to be able to do here is make sure that you understand there is going to be a liaison of the TRC's calls to action to the United Nations Declaration on the Rights of Indigenous People, which is now part of Canada's legislation. So there's another hook. There's another role and responsibility. But by doing all of those, we'll be able to work with our federal, provincial, and territorial partners and our national Indigenous organizations, the Assembly of First Nations, the Inuit, Spirit, Kanatami, and the Métis National Council. In addition to those, we have an augmented level of Indigenous healthcare provider organizations with dental, with pharmacy, and the list will go on. But it's bringing all of those voices together and making sure that we're able to respond collectively in addressing the TRC's calls to action. The final step becomes partnership, governance structures, and data collection. We will help collect the data that is important to our people and for the many generations that are yet to come. I encourage you to participate, engage, and be active in that data collection. Don't try to own it. We'll share it with you. Be part of the table. Be part of the discussion. Be part of an interesting time that is coming around the corner. Thank you for the question.
Thank you. And that brings up a phrase that we often hear in our Indigenous circles, nothing about us without us. And so that has to be the way forward. Thank you. And Brienne, how about in the sort of urban Indigenous health centers? What's happening in that area that's helping to advance the calls to action?
Great. Thank you, Jen. Thank you, everybody else. I'm happy to share a little bit about what's happening in Deodora Desne, which is an Aboriginal Health Access Center serving urban Indigenous populations. And the word Deodora Desne actually directly translates to taking care of each other amongst ourselves, which is a really lovely sentiment when we're talking about providing care for our Indigenous folks. We all sort of know when we talk about this, it's number 22 here, is that finding our way to back to sort of those traditional ways of healthcare is really important. It's a priority. And it's really just as a basis for healthcare overall. But we know at Deodora Desne, as I'm sure many of you do, that funding is often a challenge when we try and do things like this. And so whether we're advocating directly for increasing those fundings, it's important to also think about the way that we deliver care if it is in a Western perspective. So we can do that differently in a number of ways. We can think about offering a more integrated model of care, really thinking about bringing all of the aspects of wellness into primary health care. How are we making sure that we're connecting with all of the folks who are involved in your overall well-being and health? Indigenous health centers like Date Odedesne and other Aboriginal health access centers really prioritize that wellness in the way that they offer in direct care. We think about things like mental health, community living, and specialized youth and elder care. And at Date Odedesne, patients also have longer appointment times. So that's an intake where we also look at the whole family approach. We think about things like mobile clinics in response to this. How are we taking care of people? Going to where they are. We heard that in the video, right? People don't access healthcare. So how can we get it? We can go to them. So that's really that value of this practice of care is really, it's important. It's listening to our communities. It's being in response to what they need and offering care in the best way in which they can receive it. In terms of sort of government advocacy and that type of work is also important. That recognition of this work is important. So Date Odedesne specifically, we proposed an overall community wellness hub in development for an urban center, an urban core. And we had to advocate for more than 10 years that this is something that needed to happen. It wasn't a wish, it was a need, it was a necessity. And so that years of advocating have realized itself. And that is almost to the point of shovels in the ground in Hamilton, Ontario, where a wellness center will then embody that overall wellness and that approach to care. So I think one of the other things just to say, this is all about wellness and the social determinants of health. And how can we get there? It's by continuing to ask and have governments recognize the need for the way that we need to run our healthcare, the way that we need to see it practiced, and run in those ways and be responsive to that to support those Indigenous-led initiatives in our spaces.
Thank you so much. And the message overall from what I'm hearing from all of you is to remind all of the nurses on this call that for Indigenous peoples, it's not about responding to sickness. It's about being well, and it's about well-being, right? And health. Thank you. I appreciate that. So the last piece that I'd like to talk about in our fireside chat is something that perhaps some of you have heard of before. And I'm going to just again share I think my screen, I have to share it again. I want to be able to see people. So there in the next slide that I have here. Hang on, I've got to, there we go. Okay, so I'm still sharing, right, Hillary? Yes? Okay. So Joyce's principle, perhaps some of you have heard this before. If you're not familiar with this, it's named after Joyce Echaquan, who was verbally and emotionally abused by nurses at a hospital in Joliet, Quebec in the year 2020. And the reason we know this is because she filmed it using Facebook Live. She subsequently died in that hospital, and an inquest into her death was held, and it found that systemic discrimination and racism played a role in her death. Immediately after that report was issued, the Premier of Quebec said, quote, "There is no systemic racism in Quebec." So how can we address a problem when governments are not even admitting there's a problem? As the report that came out and that gave us Joyce's principle said, we must take a strong stance against systemic racism lived by Indigenous peoples in healthcare and in social services. And so this is what it says, Joyce's principle. Joyce's principle aims to guarantee to all Indigenous people the right of equitable access without any discrimination to all social and health services, as well as the right to enjoy the best possible physical, mental, emotional, and spiritual health. Joyce's principle requires the recognition and respect of Indigenous peoples' traditional and living knowledge in all aspects of health. Now, this should be self-evident. Every human should have these rights. The fact that we need Joyce's principle says that Indigenous people have not been afforded the same rights as other Canadians. And so the final question for our panelists, and then we'll take some questions from the audience. What can Canadian nurses, what can the nurses on this call in this fireside chat do to embody and implement Joyce's principle? What can they do in their daily practice as nurses to move us forwards toward reconciliation? And what are some other calls to action for nurses that would be practical that we could share today? So I'll start again with Hillary.
Thank you, Jennifer. I think it's important to start with by saying I consider nurses to be the gatekeepers of the healthcare system. They are the individuals who are often the first point of contact for patients and are without a doubt the healthcare professionals that spend the most time directly with patients. As nurses, we have a major influence and thus the power to positively shape the healthcare experience for our Indigenous care recipients. As nurses, we must not only be aware of, but acknowledge the power imbalances that exist between healthcare professionals and Indigenous care recipients. These imbalances are attributed to the historical forces of colonization, which we've discussed here today, and that continues today. As nurses, it is our responsibility to check our own privilege and bias. We all have them, and ensure there is no negative impact on our care provision. Yes, this is uncomfortable, but that is when the best learning occurs. We must get comfortable with the uncomfortable. As nurses, we must be humble and recognize that our typical Western way of doing things, as we have all been educated in Western systems, is not always the right way. We must be prepared to learn and to unlearn. And if we don't know or we aren't sure, it's okay. We must simply ask. We must be accountable, acknowledging we will not always get it right. And that's okay. Once we know better, we will do better. We must allow for the safe inclusion of cultural aspects in care provision, giving credit to traditional medicines, foods, and ways of healing. We must avoid the use of medical jargon. We must assess for potential language barriers. It's important to recognize that just because someone can speak English doesn't mean their preferred communication is not in their own Indigenous language, with which they may understand better or simply feel safer communicating in. We must assess all social determinants of health, provide holistic care provision, and if desired, engage family members in care planning. We must recognize the importance of nonverbal communication and understand there may be different meanings depending on the individual you are caring for. For example, Inuit may scrunch their nose to indicate no or raise their eyebrows to indicate yes. We must enable self-determination and understand that even though decisions may not be in line with our own personal belief system, that they must be respected. We must recognize the importance of strength-based and trauma-informed approaches to care. And finally, I'm calling on all nurses to treat culturally safe care provision in the same manner they would treat medically safe care. As a new nurse, I remember how I felt going in to insert an IV or a catheter. I would always look it up beforehand to ensure I would be doing so safely. The same principle applies. If you are working in an area where you are providing care to an Indigenous community, you should take it upon yourself to become familiar with the cultural practices, traditions, histories, and ways of life of the people that you are caring for.
Thank you so much, Hillary. There's so much in that short amount of time that you spent, and I really like when you talked about being accountable. We hear this word all the time, right? Is who is being accountable to who, right? Is it being accountable to governments or hospitals or doctors, or is it being accountable to Indigenous peoples and, being accountable for becoming culturally safe and aware? Thank you so much. Mary Lee, what would you say about how to help nurses implement Joyce's principle and other actions that they can take into their own practice?
While there are so many things, it's like curdling wild kittens in a barn. There's a lot to do, and it seems overwhelming. And that is why Sina is enthusiastic about this partnership that we will readdress with the Canadian Nurses Association. The time has come for us to work collaboratively and find that happy place, if there is one, and there is, to being able to identify what are the paths forward that we look forward, that we try to address in an action plan, what needs to be part of that action plan, what will be measured, and what is the benefit of all of our Canadian nurses participating in that initiative. We know that there are training programs. They have to be available to Indigenous and non-Indigenous nurses, regardless of where they live, and without fear of retaliation for taking those programs. We need to be able to support them during their work hours, after their work hours, to taking some of these online programs as part of their accreditation or their certification process, as part of their continuous lifelong learning in Indigenous ways of knowing and Indigenous nursing knowledge. We have to be able to address the decolonization of the current curriculum. It has been based in Canadian state and province. It has been governed by federal, provincial, and territorial governments. It has not had the content of the Indigenous value sets that we all hold dear from First Nations, Inuit, and Métis lenses. There is information that will never be written down. So don't be upset. Don't be hurt if you're not invited to the table. There is a reason, and that is why we have been strong for hundreds of years. We have to look at the recognition of our Indigenous knowledge, the Indigenous knowledge that we hold dear while we watch our Mother Earth being devastated by climate and environment. You have to wait for us in the Indigenous knowledge. When I look at the other areas, and I mentioned them to you, number 7, number 10, number 57. In number 7, number 10, it's about also learning about education, basic language. Take part in it. Learn about the languages within your region. Learn about those people. Addressing discrimination. It was unfortunate that Joyce's demise ended up having to result in a principal. Let's learn how to be proactive rather than reactive. If you see it and you think it's wrong, then say something. It's a basic instinct. You know it, you feel it in your stomach, and you get enraged. Do something. Find the supports. Contact one of us. We'll help you be that voice. It's also, being able to stand up to and looking at the Government of Canada's mandate. They have mandated you, the settlers, to be able to respond to the TRC's calls to action and measure the value of your commitment. What have you done? Where have you gone? Champions like the Canadian Nurses Association and other organizations that have come to the table have recognized their role and responsibility. And yes, it was uncomfortable, but let it be, because that's how we're going to be able to do reconciliation together. That's how we're going to be able to grow, and that's how you're going to be able to get better nurses, knowledge, and respect for one another. Thank you.
Thank you. Thank you so much, Mary Lee. So maybe a couple of things to add on to that, Brianne. A lot of good comments made so far.
Certainly. I think I just want to echo that, education is consistently the most important thing we can talk about. Education, cultural safety, learning about who are the folks in your area and how can you do that. I think one of the things is that reconciliation is the responsibility of everyone. And if we can take that away as a piece from our conversation today, knowing that we all have a responsibility in this work, in our own professions, in our own workplaces, in our own homes, it's not to rely on Indigenous folks to do this work for you. We can do it alongside of you, but you also need to be doing that work in your own space and time. I did see there was a quick question in the comment, and it aligns with what I'm saying, is around sort of being an ally and finding out how to do this work in a good way. And so I just want to mention that, one of the things that we have to do, or I would call on you all to do, is to not sort of lean on your Indigenous colleagues in the moment all the time, but also do that responsibility to learn in advance and not sort of take it as a teachable moment every single time, but to know that you can build up your own knowledge and do that work in a good way. Because we hear that our Indigenous folks are getting burnt out, but we want to help them and we want to help. We're all advocates for our people. That's why we're here. That's why we're in these roles that we are in. And so just to find a way to help them and hold them up at the same time is taking some of that responsibility on yourself. So I think that's a very good start. Some of the things that we've shared with you today, taking that basic knowledge and doing some more with it. Mary Lee's put out a call for the calls to action. Hillary's mentioned a number of things on where we can learn more and how we can do more. And at the very least, I think to echo the whole principle in Joyce's principle is that at the very least, it's about humanity. Let's treat people like people and not ever forget that, right? We're in that profession where we're dealing with humans and people all the time. And, just to uphold that vision will be the most important in this work.
Thank you, Miigwech. Thank you so much to all three of our panelists. So much to think about. As I said at the beginning, I know we only have an hour together, but hopefully this has planted some seeds in all of the nurses that have taken the time to be part of this fireside chat. And in our Indigenous ways, we do think in a sort of holistic way. You know, colonization brought a different way of thinking, and if we think back to the time immemorial and the way we did things, it was in that holistic way. And now going forward in truth and reconciliation, it has to come back to that circular way, that holistic way of doing things, the things where we do things together, and where we do things where we understand that we are all related and that everything is connected. And so I hope this has given you some things to think about today as we start off a Canadian Nurses Week. I would like to now take a few minutes to open it up to some questions. We probably have time for maybe one or two. So I will turn to, I think we have some questions. Again, I thank you to Sahar from CNA, who's putting up a couple of questions in my chat so that we can see them. So question number one, how do we send a strong message that we take racism and aggression very seriously here and now? So it's not directed to anyone in particular. Would anybody like to take that one on? How do we send a strong message that we take racism and aggression very seriously here and now?
I'll take it for you, Jennifer. So
Thank you.
it's a matter of looking at how we want to be able to address this. Remember that the United Nations Declaration on the Rights of Indigenous People is now a part of Canada's health legislation. It will also be the catalyst for how you're going to place your complaints, how you're going to address them. We are still working on ways and paths of an ombudsman, somebody to liaise, somebody to be the voice. Sina is the voice for Indigenous nurses and other healthcare providers. However, we're finding now that the call for that request is now expanding. We're hearing from other non-Indigenous nurses whom just feel safer, and I'm grateful to
Yes.
that, to coming to Sina and saying, "Can you help me?" Sure, we can. If I can't help, I'm going to call up Hillary. I'm going to call up other people in the network. And I'm going to say, here's what we got. We got a problem that's happening over here in this part of the country. Let's check the pulse on it before it becomes dangerous. What we need are be able to have actions, and we're going to be having that action plan. We're going to be looking at how we report that. We're going to be looking for ways to make it safer for you in your workplace, in your education, and in your respective environments. Thank you.
Thank you. Excellent. Very good response. All right. Question number two. Has the Canadian Nurses Association considered making a public apology to Indigenous peoples in Canada for the harms nurses have done in assimilation and cultural genocidal practices, such as residential schools, administering medical experiments, or running Indian hospitals, etc.? The Canadian Medical Association made a public apology last year. So I'll ask Hillary to talk about this, but I will just say that Envision did work with the Canadian Medical Association, and because they went on the journey to be open and to listen and to add Indigenous people to their board, to their staff, this came up and this became an important thing for CMA to do. So I can say that as you start down the journey, it's an important question. So I'll just turn it over to Hillary.
Thank you, Jennifer. And I appreciate the question from the attendees. Absolutely, CNA has considered making a public apology. I think that it's really important that as we move towards an apology, we need to do so in a meaningful way. As the voice of all nurses across Canada, everyone is on their own journey towards truth and reconciliation, CNA being in its infancy stages. So if we were to make an apology tomorrow, I think the concern would be that it would be performative. So to make sure we're doing it right, we're doing it in a meaningful way, we need to really do a deep dive into the harm that has been caused and to ensure that we fully understand and that our members truly understand what we are apologizing for. So long answer short, yes, we will be looking into doing an apology, but it's going to take some time to do it in the right way. Thank you.
Excellent. Thank you so much. So I think we just have time for one more question. And so I'll go to question three, which is, I'm very concerned about burnout in Indigenous nurses. On the TRC committee that I sit on, there are Indigenous colleagues, but they are asked to be on more committees than there is time in a day. How can I be an ally to them and yet continue to make sure Indigenous voices are clearly elucidated and acted on? And referencing call to action number 24. I don't know who might want to try
I'll
this
take
one.
that closing because I see that we're running out of time here and I want to make sure that we get that. It's a matter of expanding your network. There are a lot of people still that don't want to identify as Indigenous within their workplace, within their education, within the schools of nursing for various reasons. And we all know what that is. I'm not going to tell you. I think you know. I think that we need to be able to look at if you see that person, experiencing burnout, they were having mental health issues. It's an issue to saying to them, "Are you comfortable talking to me? Can there's something that I can do?" Providing information, a lot of it, just flood the systems. Providing information to making an informed decision about how you're going to protect yourself. Remember that if you don't protect yourself, you won't be of any use to anyone else. Look after yourself as a nurse first. You are the pivot point within our communities. You are the first person that anybody will run to. Let us make sure that we're there to support you. Let us make sure that we're there to help you get a safe place, to feel protected, and to be that voice that you need.
Mm. Miigwech, Chi-miigwech, thank you so much to Brianne Smart, to Mary Lee Nalgizik, to Hillary Fry. We're so appreciative of everything that you shared with us today. And thank you all who've joined this call for this CNA Fireside Chat on the role of nurses in Indigenous healthcare. So as we finish, I will turn it back over to Hillary from the CNA for a few closing remarks.
Sorry, before you go back to Hillary, can I just jump in there? I just wanted to be able to say to the people who put some comments or some questions into the Q&A that, we're going to try to answer them for you. As you can see, an hour wasn't enough, but we'll try to get some answers to some very important questions that you provided. Again, Jimmy Butch, Hillary, over.
Thank you so much. I just want to start by thanking my colleagues today for taking this on with me. It's been wonderful. I'm so happy to be here with you all and to share the knowledge that we have. And thank you to all the attendees for taking busy time out of your lives to be here and to have a listen to us. And I really hope that you've taken something from this that you feel is valuable and you can, put into your practice. It's just a drop in the bucket, really. There's so much we could talk about. There's so much that we could learn. So I encourage folks on the line to stay tuned. We will be hosting our first anti-Indigenous racism knowledge sharing event in September in honor of the 10th anniversary for Truth and Reconciliation, where we'll have some really strong Indigenous voices at that table to share more with you about some of the history, learning from Indigenous nurses, and then, how do we move forward together in a good way and prevent some of the harm that, of course, is occurring every day. I'd also like to let folks on the line know that if you have questions that were unanswered in the Q&A as we ran out of time, you can see the email that Sahar just shared with attendees and feel free to reach out. We'd be happy to answer any questions that you may have that were unanswered. And again, thank you so much. So grateful to be here and hope everyone has a wonderful day. Thank you.
Take care.
Yeah. Bye-bye.